Hi and hello. The topic for this research paper is the effect of COVID-19 pandemics and vaccination towards Malaysia stock market. The pandemic of the COVID-19 not only threatens individuals' lives and well-being, but also has significant economically costly pandemics in recent history. According to Boise and Rukcharoengkitko, 2020, the synchronously of worldwide lockdowns and financial market trauma make the COVID-19 pandemics varying from the previous pandemic episodes. As a result, the economy suddenly stops, and because of that COVID-19 global recession is distinctive. Besides that, Ozalai, 2020, said that COVID-19 pandemic not only forced the shutdown of commercial activities, but many companies also suffered liquidity shortage, since it affects investors' investment decisions due to uncertainty on the cases of COVID-19. However, on December 2, 2020, the United Kingdom's Medicines and Healthcare Products Regulatory Agency, MHRA, gave regulatory approval for the Pfizer-BioNTech COVID vaccine. And on February 24, 2021, Malaysia starts its COVID-19 vaccination program, with Muhyiddin Yassin as an 8th Prime Minister as a first person taking the jab. Currently, Malaysia approved 7 types of vaccines to prevent COVID disease by triggering an immune response. The main gap, in the existing research, is the absence of a comprehensive view on the role of mass COVID-19 vaccination in a Malaysia stock market, besides the impact of COVID-19 on the stock market, after almost 2 years the virus attacked. Objective of this study is to analyze the effect of the health crisis COVID-19 and the vaccination program on the Malaysian equity market. This research contributes to 2 prime strains of the finance literature. First, this research explores the role of vaccination programs on the Malaysian stock market. Second, this paper adds to the research on the impact of the COVID-19 pandemic on the volatile financial markets. This paper also includes the number of recovered cases from COVID-19 as one of the variables, since there are several times the number of recovered cases shows a higher number as compared to the number of COVID cases. Thus, it triggers a question: does the recovered cases will give an impact on a stock index or not? According to Boise and Rukcharoengkitko, 2020, pandemic of the COVID-19 not only threatens individuals' lives and well-being, but also has significant economically costly pandemics in present history. COVID-19 pandemics is varying from previous pandemic episodes, since it causes worldwide lockdowns and financial market trauma synchronously. As a result, the economy suddenly stops, and because of that COVID-19 global recession is distinctive. Albulesco, 2020, said that the number of COVID-19 cases reported in China had a negative relationship with stock market volatility, but the number of COVID-19 cases reported outside China tended to shoot up the stock market volatility. However, he also found a positive relationship between financial market volatility and the death ratio inside and outside China. Beside that, Zarin and his RC, 2020, employed the daily data of the total number of COVID-19 cases, the total deaths caused by COVID-19, and the stock markets, from January 2020 to March 2020, to examine the impacts of COVID-19 on several stock markets. The results show that the stock market in China, Korea, and Spain have a relationship with a total number of COVID-19 cases. On the other hand, the stock market in France, Germany, and Italy fail to show any relationship with the COVID-19 cases. Louis et al. 2020 showed a drop in abnormal return of the stock indices due to investors' pessimistic sentiment. They also reported that the abnormal return of Asian stock markets tended to fall more as compared to other indices during the COVID-19 outbreaks. While KLCI ETL 2021 is the first group of researchers does the study the effect of COVID vaccination on the stock price. They scrutinize 4 daily sets of data, namely S&P stock market return as a dependent variable and COVID-19 daily confirmed number of infections, deaths, and vaccinations as independent variables. Their research covers from December 20, 2020, to April 9, 2021. They found that all the variables significantly positively influence the S&P 500. Therefore, they suggest the U.S. government continue with their vaccination plan since it is beneficial for fighting the COVID-19 pandemics. Besides that, ROAT by ETL 2021 employs data from 66 markets around the world for the period of January 1, 2020, to April 30, 2021, to investigate the effect of vaccination on stock market volatility. By using panel regression, they reported that vaccinations aid to lessen market volatility in both emerging and developed markets. They conclude that government health targets to achieve herd immunity within society via vaccinations are encouraging to stabilize the stock market. Sample: Malaysia starts its vaccination program on February 24, 2021. However, the fully vaccinating individuals are just available 4 days after that. Therefore, to examine the impact of vaccination and COVID-19 cases on the Malaysian stock market, this study will employ the daily data of the period February 28, 2021, to August 31, 2021. The data on stock market indices were collected from Yahoo Finance Database, 2021, while the data on COVID-19 were extracted from Worldometer Statistics, 2021. This research will employ Kuala Lumpur Composite Index, KLCI, as dependent variables, while the independent variables used in this study were the number of COVID-19 confirmed cases, the number of deaths due to COVID-19, the number of recoveries from COVID-19, and the number of people fully vaccinating. This figure presents a descriptive statistic for all variables used in this study. A standard deviation is calculated to determine the dispersion or fluctuation of a data set to its mean. Vaccinated people show a highest standard deviation of 4,093,738.50, followed by COVID-19 cases, 6,850.22, recovered from COVID-19 cases, 5,754.49, death cases due to COVID-19, and the last one is KLCI, 39.65. Thus, this result shows that KLCI is less volatile as compared to other variables. The maximum value of KLCI is stood at 1,639.83, while the minimum value is 1,489.80. Whereas, the range numbers of vaccinated people are between 3 and 15,032,301. On average, Malaysian daily COVID-19 cases are 7,826.70. However, 82.29%, 6,440.86, patients are recovered while only 1.07%, 84.02, patients die. The highest numbers of death cases are 393 and the highest number of COVID-19 cases are 24,599. This figure presents the outcomes of correlation analysis. The outcome shows that each variable has a significant correlation with other variables. The three strongest correlations were found between the vaccinated people and recovered cases, with a correlation of 0.964, followed by the recovered cases and COVID-19 cases, 0.957, and COVID-19 cases and vaccinated people, 0.949. Besides that, the results also reveal that all the independent variables are negatively correlated with the dependent variable. The most independent variable that correlated with KLCI as a dependent variable is death cases with a correlation of 0.659, followed by recovered cases, 0.628, vaccinated cases, 0.614, and lastly is COVID-19 cases, 0.747. There are two regression models to be tested in this study. First. Second. Where SIT is the Kuala Lumpur Composite Index, KLCI, at the day T. C19 tons is the number of COVID-19 confirmed cases in Malaysia at day T. DEAT is the number of death cases due to COVID-19 in Malaysia at day T. RECT is the number of recovered cases from COVID-19 in Malaysia at day T. VACT is the number of people fully vaccinating in Malaysia at day T. The sign of T-1 refers to the day before day T. Equation 1 applies to Model 1, in which the KLCI is used as the dependent variable. While Equation 2 is generated because this paper also aims to observe the impact of previous day information on the Malaysia stock indices. Thus, the lagged independent variables will be used to estimate the KLCI. This figure presents the results of the regression analysis. The F-tests, measure for the strength of the regression, reveal that both models are significant at 5%, p-value equals 0.000. Therefore, it can be concluded that all variables are vital in determining a Malaysia stock index. In terms of the coefficient of variation, R-square, the second model is slightly better in explaining the variation of KLCI. The explanatory power for Model 2 is 67.4%, whereas for Model 1 is 67%. This indicates that the variation of the dependent variable is explained by more than 65% of the independent variables. This figure shows results of Ttest. The T-tests show that all variables give similar results for both models. All the variables except death cases were significantly related to Malaysia Composite Index. It discloses that either the current information, or the previous day information, will influence the performance of KLCI. The number of COVID-19 confirmed cases in Malaysia, on the same day or earlier day, had a significant negative effect on KLCI. On the other hand, either the same day or the earlier day, the number of recovered cases, and the number of vaccinated people in Malaysia were positively and significantly influencing KLCI. This findings indicates that a worsening outbreak of COVID-19 tend to decrease the performance of KLCI, whereas the increasing number of recovered cases and immunization program will help to incline the KLCI performance. This empirical result confirms that the Malaysian stock market is also disrupted by COVID-19 cases. The uncertainty about the COVID-19 cases influences investors' decisions in entering the stock market. These findings are supported by Al-Awadi, Al-Saifi, Al-Awadi, and Al-Hamadi, 2020, Haryoto, Rossi, and Paglia, 2020, and Liu, Manzoor, Wang, Zhang, and Manzoor, 2020. All of them provide evidence of a significant negative effect on stock returns. They also agreed that the pandemic has led to excessive risk and uncertainty in the global financial market. On the other hand, the positive and significant effect of the vaccine shows that the immunization program is not only beneficial in protecting people against disease, but also gives some confidence for the investors to trade back. Malaysia had launched its immunization program in February 2021 to curb and end the COVID-19 pandemics. A similar result was found by Calfewi, Namuri, Labadai, and Benjabair, 2021, and Roatbai, Demir, Kizis, and Zaremba, 2021. They give a recommendation for investors to closely follow the development of vaccination policies of countries, and alter their portfolios based on the vaccination policies. Further, even the number of death cases has a negative coefficient. The critical value is insignificant for both models. Therefore, it shows that KLCI does not have any significant relationship with Malaysia's number of death cases either on a similar day or the previous day. The results of the analysis demonstrate that during this period of coronavirus outbreak the KLCI stock markets responded negatively, and in a significant manner to the increase in COVID-19 confirmed cases. However, the numbers of recovered cases from COVID-19 and fully vaccinated people influence positively and significantly the KLCI stock market. This study fails to find any significant response of the KLCI stock market to the increase in COVID-19 confirmed deaths. These findings suggest that the investors in the KLCI stock market are more anxious by information about COVID-19 confirmed cases, the patient recovered from COVID-19, and the numbers of public immunized from COVID-19, as compared to deaths caused by the COVID-19. Further studies on the topics discussed in this research may continue the analysis by using longer data set, since the main limitation of this study is the fresh and relatively short sample period. Future researchers also may explore more proxies for the COVID-19 outbreaks. Besides that, this paper had revealed that the vaccination program has given a positive impact on the equity market. Thus, future researchers can investigate the impact of immunizations on other asset classes such as properties, currencies, or the debt market. That's all for this research presentation. Thank you.